So welcome everybody to our second Medicare session
Right.
on covering Medicare Part D, the prescription drug plan program. Steve's going to cover that for you today. And then I am going to talk about how Medicare works with other coverage and some important tips that you need to know about that. And again, thank you for coming on, and sorry about the time mix up, but we're glad you're here now. And if you could please
Yeah.
sign your name into the chat. Go ahead and mute yourselves, unless I will do that as well. But I think we are still letting a couple people in, Steve.
All right, well,
And Silas said he will send out the recording for the first session and a second session after today's session.
so while we're waiting for everyone to come in, I'm going to let you in on a little secret that I got a phone call at 7 o'clock this morning from Silas saying, "Hey, I've got to be on some meetings, so can you guys just run this for us?"
Yes.
So if you kind of come out of this like, those two don't know what they're talking about, there's a reason. We didn't have time to prepare, so we're going to do the best we can.
Oh, and he owes
You guys
us.
are old pros. What are you talking about?
Oh my God, we do this in our sleep, right?
Yeah.
Well, Ray usually does the VA and the employer group. So it's like, I don't pay attention to that stuff because Ray's got it dialed in and he couldn't make it today either. So it's like,
Yeah, and you know, honey, I know enough to be dangerous, so we're
there you
gonna
go.
go with that.
That's all we need. So are we good to
We are
launch?
good. Go ahead, my friend.
Okay. So again, obviously we're talking about Part D prescription drug coverage. Usually every year this is pretty routine. In 2024, it's not because the whole Part D plan's changing in 2025. So I will share with you what I know, but we're really not going to see the true impact of this until after October 1st. So we'll just kind of run through it. So a lot of the stuff that I'm going to go through with you actually can be found on United Healthcare. And I don't know if you guys know this, but if you go to is it Jarvis now?
Yes,
Getting rid
enroll
of Wayne.
Jarvis.
If you go to Jarvis, there's actually what's called an agent toolkit where they have all kinds of information that you can use to help. They have a new to Medicare section, and that's pretty much what I use to do my 101 presentation for people. Is they have a thing called Get to Know Medicare. They have it in a PowerPoint, and they also have it in a document you can download and create a pitch book for it. So what I'm going to do is I'm going to go through their Part D version in there, but there's a lot more to this. If you guys ever, especially with you that are new to Medicare, that is a phenomenal resource for you to have, because if you can just learn to present it to your customers without you understanding it fully, you're in total compliance, because they cover everything that needs to be covered on a Medicare presentation in there. So, and if you guys ever want me to kind of show you how I go through it, schedule a meeting with me and I'll kind of show you how I do it. But I've been doing it this way for many years, and every year they update it to have the most accurate numbers. So again, go to Jarvis, find Jarvis is new. So I had to dig a little bit for it, but I think it's under the sales tools or something, you can find it. So let's talk about the Part D prescription drug plan. So what this does is Medicare Part D insurance provides coverage for prescription drugs and some vaccines. And there's two ways in which you can get the coverage. One is called a standalone plan. The other is getting your Part D and a Medicare Advantage. But the thing that a lot of people struggle with is, are they different? And they're not. Part D is Part D. It's just, how are you going to get it? Are you going to get it by yourself because you're staying on original Medicare and you need something to cover the drugs? Or are you going to get a Medicare Advantage plan that has the D embedded in it? Okay. So Medicare Part D plans cover types of drugs most commonly prescribed for Medicare beneficiaries as determined by federal standards, specific brand name drugs and generic drugs included in the drug list, which we know is a formulary, and commercially available vaccines not covered by Part B. So again, there are some drug stipulations in Part B. a lot of your injectables are actually covered by Part B instead of Part D. Okay, so that's just understanding the difference. So, but again, there's some commercially available vaccines that you can get right through your Part D drug plan. So what is a formulary? It's a list of prescription drugs covered by a plan, and they're tiered. So drugs are grouped into tiers based on cost. And in general, the lower the tier, the lower the cost. And deductibles may be charged by tier. And that's what you're going to see a lot in 2025 is I think most companies, because like right now, there's some companies, they don't have a drug deductible at all. You're going to start seeing drug deductibles on tier 3, tier 4, and tier 5. Now, the other thing about it too, when we go to, I'm going to show you how to do this on Connexure. Connexure doesn't list tier 1, tier 2, tier 3. The actual proper names is tier 1 is actually what's called preferred generic. Tier 2 is just generic. Tier 3 is preferred brand name. Tier 4 is non-preferred brand name, and tier 5 is specialty. Okay, so you'll see some companies that will just list it tier 1, tier 2, tier 3, tier 4. You'll see other companies that'll list it by the name. It's the same thing, guys. So again, I'm telling you the names because it's not showing it here, but when you go on to Connexure, you're not going to see tier 1, tier 2. You're going to see the actual names. And so as long as you can understand what the names are, you know what tier they are. Okay, so you can, because again, you may be looking at Connexure, but then you may be showing someone an outline of coverage or a summary of benefits that says tier 1. Well, you can cross-reference that, okay? Now, here's how the drug plan works today. Since the inception of the drug plan back in the early 90s, the drug plans have always had what are called stages. There's 4 stages. There's the annual deductible, the initial coverage, the coverage gap, or what some people call the donut hole, and then the catastrophic coverage. And so up until 2024, this is how these plans work. You'd have to pay a deductible, okay? Not all plans have a deductible. Not all tier levels have a deductible. But once your deductible's met, if you have one, then you go into what's called the initial coverage, and you pay a copay or a coinsurance, and you stay there till the total cost of your drugs hits $5,000. Now, that's what you pay. It's also what the drug company pays. So you may have $1,000 drug where you're paying 47 bucks, but the insurance company is paying 900. That's what's going towards that 5,000. And so most people never leave the initial coverage. But if they do, then they go into the coverage gap or the donut hole, and they stay in there until they're out of pocket. They're out of pocket. Now, the initial coverage was you and the company. The coverage gap is you. And it goes back to the very beginning, the deductible. So everything you paid, you stay in there until you hit 8,000.
How are you, Juliet?
I've got her muted.
Got it. Okay. And then if you hit that 8,000, then you went into the coverage gap where for up until 2024, you paid 5%. So up until 2024, if people were on a prescription drug plan and they were on very expensive drugs, and we always used to highlight cancer, chemo drugs, people could literally be spending thousands and thousands of dollars because there was no max out of pocket on the drug plan until they passed the Inflation Reduction Act, which started changing that. And so what happened was in 2024, they took away the 5%. So once people hit their 8,000, and let's be realistic, guys, it really wasn't 8,000. That's government fuzzy math. It was about 3,400. Once you got in the coverage gap, it became 0. And so we actually had people that got through the coverage gap, and then they didn't pay any more money for drugs the rest of the year. Okay. Starting in 2025, there is going to be no coverage gap. There's just going to be the deductible, the initial coverage, and the catastrophic gap. But the initial coverage, you're going to go into the catastrophic when you hit a max out of pocket of $2,000. So again, how much is paid for prescriptions depends on the stage. So I'm going to show you percentages in a second. Dollar limits can change each year. Not all plans have a deductible. Many people never reach the donut hole, and the coverage cycle starts over usually January 1st. So those are the stages. So let's talk about what it's going to look like next year. And so in 2025, the coverage gap phase will be eliminated and more retiree members will move into the catastrophic phase. Members will have a $2,000 annual out-of-pocket spending cap for prescription drugs in place of the current catastrophic phase. So again, in 2024, we had a $545 deductible, which was 100% on the member. Once they got into the initial coverage, the member paid 25%, it was written to be a 25% coinsurance. A lot of companies turned it into tiers. But the big thing I wanted to focus on is the carrier was obligated for 75%. Okay. When you got into the donut hole, the member still had the same 25%. And then the carriers had 75% on generics. But for brand names, they actually the manufacturer had to give a 70% discount. And the carrier got 5%. That's why when you got in the coverage gap, no one really hit the 8,000 unless they were only on generics. Because if you were on brand names, a lot of that 8,000 was eaten up by the discounts, okay? And then once you got into the catastrophic phase where there's no more 5%, the carrier paid 20%, and then literally Medicare picked up the 80%. That's how it was for this year. Now for 2025, the deductible's going up to $590, and more people are going to have to hit their deductible this year unless they're only on generic. If you're on brand name drugs, you're going to pay the deductible. Okay, there's no more plans with no Medicare RX deductible. So when you get into the initial coverage, member has the 25%, that hasn't changed. Generics carriers have the 75%. Now the manufacturer only needs to give a 10% discount, and the insurance company picks up 65%. So they went from having to pay 70 or 5% on brand name to 65% on brand name. Guys, what's that going to do to the premium? That's the big problem, okay? And then when they get in the catastrophic, this year, they only had a 20% hit. Next year, it's 60%. So even though the customer doesn't pay anything in here, they are nailing the drug companies. Now, I was at a United Healthcare deal yesterday for Northwest Indiana. And basically, when this first came out, they were going to have rate increases. There was some drug plans that were coming in at over $200 a month. Okay. And then someone at Washington realized, wait a minute, we have to set all annual notices of change have to come out in September. Do we really want to give all these seniors this really good news that their drug plans are going to double or quadruple before November 3rd?
Sure.
So what they told them then is, look, if you need to raise the rates, cap it at $35 and we'll pay the rest. So literally the government is telling the world they're doing this great thing only to be funding it through taxpayer dollars. Okay? So that's what's going to happen. But the other thing that's going to happen is you're going to start seeing when you get past the tier 1 and the tier 2 drugs, there's no more tier 3 $47 deal. From the plans I've seen so far, and I haven't seen them all, but when you hit tier 3, it's not a copay, it's a coinsurance. So again, if I'm taking $1,000 drug and I got a 47 or I've got a 30% coinsurance, that's a big number. Okay. So here's what's going to end up happening. The good news is once people hit the 2,000, they're done. So ultimately for people, that take a lot of drugs, it's a good thing. Here's the bad news. And again, for some of you who've been on doing Medicare for a few years, when you had people take a lot of drugs, here was the problem. Early in the year, the drugs were very manageable. And then sometime for some people in June, July, October, you got this phone call because they went to the pharmacy and their drug prices exploded. Why? Because they went from here to here. It's going to be different in 2025. The consumer's cost is going to be front loaded. So we're going to have to get really good on Connecture and show them, look, I understand the first few months may be a little hard for you, but by the end of the year, you're not going to owe anything. So all it did was invert the problem that we've had since the 90s. We had, for people who took a lot of drugs, we had to overcome when they hit the donut hole. And the nice thing about having tools like Connectures is we could sit down and show people, look, you're going to hit the donut hole here. Next year, look, you need to be prepared for January, February, March, but then the rest of the year, you're not going to have to worry about your drugs, okay? Now, because people may get blasted early, so before I go to the next slide, does anyone have any questions on this, or is there anything in the chat?
I don't have any questions in the chat. Any questions from the peanut gallery?
Is everyone tracking with what's going to happen next year?
I can
Costs are
share
gonna-
with you. Yeah, I can share with you. I have a client who really is on just a couple medications. But one of them happens to be an oral cancer maintenance medication. Retail cost is $15,000 for a 1-month supply. And this current year, we strategized. He knew he was going to pay at least, up to $3,300 for his medications. It was on his drug plan. And he was prepared. So we talked through that process. And so for next year, same type of situation. He knows he's going to hit it at the very beginning of the year, but after that, for his cost, but let's see what happens to his plan and his premium.
Right. Now, here's the other thing that nobody seems to truly understand yet, but Medicare has come out with called a prescription payment plan. And what this is, and this is something we don't have to do for our customers. Matter of fact, we can't do it for our customers. They literally have to contact their carrier and sign up for it. Okay. But what it does is and again, I'm just going to use United Healthcare's explanation yesterday. Basically, if they sign up for this, United Healthcare will pay for their drugs. They will take the cost of their drugs to get them to the 2,000. They'll divide it by the number of months. And every month they'll get a bill from United Healthcare for what they're going to owe. And they're just spreading it out over 12 months. It's kind of like 12 months, same as cash, no interest. It's just, hey, if you can't pay this, we'll pay it. You pay us back. And if they don't pay them back, after a couple of months, basically what's going to happen is United Healthcare or whoever's going to let the pharmacy know, and then they'll have to pay full cost for their drugs because they're not obligated to they're not doing their end of the bargain. So again, this is something that all we have to do is touch on it. Now, I'm sure when we start seeing some of the brochures and stuff, there's going to be a good explanation in there because they're going to have to let him know it's available. So instead of me going through all these frequently asked questions, I'm not really going to worry about it right now. because we'll get more clarification when we have the benefits, and it'll basically probably say, call this number, do this, do that to sign up for it. All we have to do is when we're sitting with people, putting them in their plan, and we see they're going to get hit at the beginning of the year, just let them know this is going to be an option where they can.
And my understanding is that they'll be able to sign up for this payment plan anytime throughout the year.
Yeah, it's just all they have to do is let them know. And I got the impression from Tom from United Healthcare that as soon as they get their card for next year, they can sign up before January 1st. Once United Healthcare or whoever has record that we're going to be covering them, he made it sound like you can sign up before you ever need it. So it's just there. So when they go to the pharmacy, okay, we need $780, because they're taking a drug where they've got to pay the $590 deductible plus whatever percentage. I mean, that first month could be between $500 and $1,000 if someone takes it. Guys, you need to be prepared for that.
Yeah, and Jeff asked, does the beneficiary decide to join or are they invited by CMS? It's the beneficiary. They have the option. They have to voluntarily sign up for it.
Now, again, this is United. They hate the fact that they have to do this, and they're not even really going to talk about it unless someone calls and asks them. They're not going to make a big deal out of it unless someone needs it.
Cheryl has a question.
It seems that, and I may be remembering this wrong because I've done several of my 2025 certifications, but I thought I saw somebody say that even at the pharmacy, have you guys seen anything of that, or am I just remembering that wrong? That like at the time of purchase that they could say, oh, I can't afford this, and that there's somehow they can do it at the pharmacy?
I think I will have more clarification after once we see it, because again, a lot of this stuff, I mean, even yesterday, I mean, this starts in a couple of weeks.
Right.
and Tom of United Healthcare says, we think the products we're showing you right now are actually what we're going to show you, but we don't know because they're changing this stuff all the time still.
And no, they haven't disclosed who the third-party administrator is yet for that. So don't worry about those details. We will get more information.
Okay, thanks.
I think, from my understanding, it's the insurance company. They pay the bills and then they bill you.
Yeah. And I don't know if they're, each insurance carrier is going to be using a third party or what.
Yeah. But it's going to be a nightmare, but it is what it is. Okay. So any questions on what it's going to look like next year, or any questions on this prescription payment plan? We good?
We're good.
All right. So here's the facts about Part D coverage. You must be enrolled in Part A, Part B, or both. So it's, Medicare Advantage, you have to be enrolled in Part A and Part B. For a drug plan, it's Part A and or Part B. Okay. So if someone's on Part A and they're not signed up for their Part B yet, and I'm dealing with this right now with someone in Michigan that they got kicked off a group plan because of disability, and she didn't take her Part B, and now they're telling her she's got to go through it's a nightmare. So I said, worst case scenario, you're in Part A. I can at least get you in a Part D because she's an insulin dependent diabetic. So I got to get you the drug coverage. Okay. If you go to the doctor, you're going to have to pay for that out of your pocket, but at least I can get you on the D. They may be required to use a pharmacy network, which most of them, they have preferred networks. Costs and coverage vary by plan and may change each year. That's why we have an open enrollment. And that's the one thing I do with all my customers is I literally just got to make sure they're in the right drug plan. Okay. And then Part D premium penalty for late enrollment unless you qualify for a special enrollment. So that's this whole idea that if you don't sign up for Part D, in your initial enrollment or in your special enrollment period, if you're leaving a group, once you decide to sign up for it, you're going to be penalized. So what is the penalty? It's 1% of the national average for each month. So right now, the national average, I think, is like $35.
Actually, it's going to be about $55.
Okay, so 55 times 0.01. So that's 55 cents a month. So let's not freak out over this. So even if I was not in a drug plan for 10 years, so that's 120 months, right? Am I doing the math right?
Yep, 120 months.
It's a $66 penalty. Now they're going to pay for it the rest of their life, but again, it's not the end of the world. Because so when and again, I come across people, they've never had a Part D. You know, I have one client, she's 80 years old. She's never had a Part D. And every year I say, unless you start taking a drug that's going to be more than the penalty, I'm not even going to worry about it. And so that's just how it works. But that's the Part D penalty is, that's why you got to tell these people, look, I know you don't take any drugs. Why would I want to pay a Part D? I don't need it. I can use GoodRx, blah, blah, because you're going to get penalized down the road because you could take drugs you are going to need. So that's why I know WellCare has a 0 premium plan and all that, or some of them have lower ones. And there's the big debate on, you know, WellCare not paying commissions and should we sell it, blah, blah, blah. You know, I'm not a big fan of doing that plan anyway, because if they take anything of substance down the road, they're going to get blasted because it's a very narrow pharmacy. But again, for those people who just don't want to have to pay the penalty, okay, pop them in it, whether you get paid or not. I mean, who cares? Okay. All right. Financial assistance programs. There's also programs that can help people with their prescriptions. One is called Extra Help. Now, Extra Help is not Medicaid. Extra Help is actually federal. And if you hit a certain income level, they will help. And every time someone becomes eligible for Medicare, they get something from the government. It's an Extra Help application. I tell anyone, when in doubt, fill it out. The worst thing they can tell you is no. But if people do get this, it really does help them on their drugs. Okay. Obviously, if people are low income, there's Medicaid, which provides health coverage for people and families with limited incomes. Programs vary by state. And then there's Medicare Savings Program, which helps with Part A, Part B costs. I don't really get into a lot of detail there. But again, the two biggest things that can help people with their drugs are Extra Help or if they qualify for Medicaid.
And we're going to be talking about all of these in our next session.
You are?
Yes.
Then say no more. I'll be quiet. All right. So
There is a question.
Go ahead.
Candace is asking if someone is still working past 65 and has coverage through their employer, so they opt not to start Medicare yet, does the Part D penalty still apply? Well, stay tuned. We're going to be covering that.
It doesn't this year. If it's creditable, it may next year.
Mm-hmm.
So you got more on that?
Yep.
Okay, then I'm not going to say anymore. All right. So let's talk about, you know, Connexure and how we do all this. Because again, I have found that I can learn all I want about the Medicare Part D program. The biggest thing is if you learn how to use Connexure correctly, you don't have to understand it at all. Okay, you just need to make sure you have an accurate description of their drugs, and Connexure is going to do the work. So let me go in here. And to be compliant, I'm not going to use a real person. So I have a client named Medicare Example. What a crazy name, isn't it? All right.
You're very original.
So again, once you go to your CRM, you have them in there. If you will just click on this button here, it will actually just port all the information from the CRM into Connexure. There's other ways you can just get into Connexure and do it yourself, but I always like to put their information in the CRM first and then just go there from here. So, you know, obviously with Connexure, you've got their name, date of birth. And I will tell you guys, especially with, Retire Flow, and we can talk about that in a second. Retire Flow is not allowed to get their date of birth. If you don't put a date of birth in here, you cannot search products or anything. So, you know, you need their date of birth to get in there. And then this is where you can put in their Medicare number, you know, scope and all that. But again, the thing I want to focus on is add preferences. So if I'm dealing with someone and with a Medicare Advantage, I always want to do medical and prescription drug. If I know someone's on a supplement, we're just doing a thing, I can just do prescription drug, but I almost do everything medical. You know, this is where you can put in if they get any of those extra things, Medicaid, extra help, because it'll adjust how the plans are going to pay. Next thing is I'd never mess with this page, so I just always put no. This is where you can put in their providers. This is great, especially if you're going to be searching Medicare Advantage plans. Obviously, if they're on a supplement, this doesn't matter. But if you're going to compare the two, you want to make sure their doctors are in network. You can put in hospitals. And then this is where you put in the prescriptions. Okay. And so basically what you do is you just type in, you start typing the name of the plan. So let's just say they take metformin. Then you pick the dosage, pick the amount, and then hit add. Okay. And so what I have done is I've just put in some of the common things I mean, this actually is a client of mine. It's just, I just changed the name. You know, I just had a list of their drugs, but they're on Eliquis, they're on Atlantis Solostar, they're on metformin, they're on, this is a blood pressure medication, they're on Ozempic, Simvastatin, and the enlarged prostate P pill at night that a lot of us guys take, okay? So once you get all those in there, and again, if you want to edit it, you can always go here, edit it. If they don't take them anymore, you just hit this and it'll pull it out. And so that's how you get them in there.
And you can adjust it to do monthly,
Yeah, you
quarterly,
can.
quantity.
Yeah, I always, yeah, you can put in there and how often do you want to do this. So unless it's something they feel like a big one is albuterol, a rescue inhaler. Well, how many? I usually get 2 a year. So I would just put in, you know, 1 every 6 months or 2 a year. But, you know, but usually I like to put everything at 30 days. So I can give them a monthly analysis. Even if they want to do it quarterly, that's fine. Let's just figure out which plan's going to cover your drugs the best on a monthly basis. So I always just put everything at 30, 60, 90, whatever they need on a monthly basis. Okay, that's just my preference. So then you hit continue, and now you put in the pharmacy. So some people, they have a specific pharmacy they like. There's other people that, hey, I bounce around whoever has the best deal. So you can do this in here. I can put in Walmart, and then maybe someone wants to do CVS. So you just hit a, you know, you always got to make sure you have the zip code. And if you're not finding it in their zip code, if you will hit this button right in here, you can expand or make it closer to do a better search. But the easiest way is if you just put in the zip code where the doctor, the facility, where whatever you want to be, it should pick it up. So then we can add that. And so now I got both of those. And now it's going to start looking at the plans. Okay. So the first thing I'm going to do is I'm going to look at prescription drugs. So I only have 12 plans in there because it's only showing the plans that I can write. But you can hit this button for non-licensed plans. And if I find there's a plan that I'm not licensed to sell that's going to save them a lot of money, I'll just go to Medicare.gov with them and sign up for it because I'm going to put them in the right plan. Okay. So when I sort these things, there's 2 ways that you can sort it. The first is estimated drug cost. Okay. So what this does is if you do estimated drug cost, it's going to show you, all right, for the, now again, keep in mind, this is starting October of 2020. That's the thing we can't hear is I can't show you a full year. I can only show you the next 3 months. Okay. But in the next 3 months, for all these drugs they take, the total cost is going to be $333. But the premium is $109. So if you want to do, so if you do it by estimated drug cost, or you can do total estimated cost, and now it's still using the same plan. That's crazy. Okay.
Yeah, because if you look at your overall total annual cost over there, it
Yep.
still ends up being one of the lowest.
Yeah. So the plan that's going to cover their drugs the best is Humana. AARP is 510. Anthem's 511. WellCare's 598. 587. The zero premium plan, 1200. That's why I don't like showing this plan. It's not good coverage if you take drugs, okay? 1400 on the Silver Script Saver. 1300 on Cigna. 1400 on Mutual of Omaha. Anthem 1400. The Humana Walmart, which is pop 1600. So again, here's one. This is a great one to be on, $4,000. So that's why we want to look at this for people. And again, if I'm doing a drug plan, I always just do total estimated cost. Okay, because it's going to take this and this. Now, here's a cool thing that you can do to show people how this works. So if you hit plan benefits, the first thing you can do is hit the prescriptions, and it actually shows where they fall. So this one's a preferred generic, or what we know as tier 1. Generic is tier 2. Preferred brand is tier 3. This is a tier 4, and this is a tier 5. And then some of these plans have what are called select care. It's like, these are the more common drugs where you can pretty much get them for free, okay? So what it does when you look at here is so let's go to this Eliquist. It's a $571 cost, but while they're in the initial coverage, it's a $45 copay. But if they ever hit the gap, it's $142, which we're not going to have to worry about the gap next year. Okay. Ozempic, $930, $45, but then it jumps up to $237. That's that jump I was telling you about that we get mid-year that people aren't prepared for. And it's going to be different in 2025. The bigger number is going to be at the beginning. And so here's how I actually like to show people what their drugs are going to cost. Is I hit this total estimated cost, because what it does is it shows them their premium plus their drug cost. So in October, you're going to pay $111 for your drugs. Okay. In November, you're going to pay $111. And then in December, you're going to pay. So I tell people this, or I show people to this, that look, as long as your drugs don't change, this is what you're going to have to budget for your drugs. And I think this is going to be the page that's going to save our butts for 2025, because we're going to be able to show them, okay, when you go to the drugstore January 1st, you're going to need $700. Well, I can't afford that. Then you better sign up for the monthly payment plan, because there's no way around it. Because if I start with which one's going to cover your drugs the best, it's only going to get worse as I go down. Okay. So that's how you look at standalone drug plans. But the other thing you can do, let me go back to this. So at Walmart, it's $333. At CVS, it's $395. So that's why if someone has multiple companies they're willing to work with as far as pharmacies, you can show them where to go. Okay.
Mhm.
And then if they want to do mail order, it shows them mail order. Okay.
And if
So
you go back to Walmart,
yep,
you'll see it says right underneath it, it says preferred in-network pharmacy, right in the middle there. And when he went to CVS, it says standard in-network.
Yep. So, and then if you go with some of these where the numbers start jumping up, you know, standard, here's a preferred, but they're just, so again, let's look at this Aetna and see what the deal is.
It's a lower monthly premium.
But
It's not covering certain medications.
Eliquis is $349. Why? Because they're making them pay a deductible. This is what we're going to see more next year, is we're going to see a lot more of, hey, you've got a couple of things here because you've got to hit the deductible first, which the deductible was $280 on this plan. Guys, the deductibles next year are going to $400 to $500. It's $590, but some of the plans I've seen, it's $420, it's $550. You people gotta be prepared for this. And that's why having this tool is going to be a CYA, because you're going to be able to tell, they're not going to be able to come back to you and say, you never told me. No, I showed it to you. Okay.
Yeah. Maggie had asked a question, is there a way to not enter a pharmacy and see what pharmacy has the cheapest drugs? No, the only way you can see the cost in a pharmacy is you identify the pharmacy.
Yeah. And you can, I think you can put up to 3 pharmacies plus
Mhm.
mail order.
Mm-hmm.
And most of the time, unless people live in certain areas, most of the time it's going to be Walgreens, CVS, Meijer, Walmart. Costco, if there's a Costco around, you may get that.
Mm-hmm.
And every once, like in my area, there's a place called Phil's Drugs that it's in a local supermarket, and people like it because it's kind of a family type deal. But you can pop them all in there. I mean, if it's a legitimate drug place, it will show up on that search. So if they have this little homegrown pharmacy they like, pop it in there and show them if it's worth going or not. Okay. Any other questions on this, Sandra?
No, I think we've answered everything else.
Okay. So let's go back to this. So 333 on a Humana drug plan. So now again, when I go to Medicare Advantage plans, if I do estimated drug cost, and what I like to do is I like to, again, this is just me, I like to get rid of the HMOs because I do not sell HMOs. Okay. So based on this, here's an Anthem Medicare Advantage plan, $359, so pretty close, but it's a 0 premium. What was the premium on the other one? $109. Okay. And again, the nice thing, the doctors are all in network, the drugs are all covered. $387 for Aetna. $419. What's United? $431. So again, the reason I'm showing you guys this is when I meet with people, the thing I'm looking to do is I'm looking to get them in the plan that's going to cover their drugs the best. Anthem, United, Aetna, Humana, they all have good Medicare Advantage plans. I'm just going to look at which one's going to cover their drugs the best first, make sure their doctors are in network, but then here's how I do it. So in this case, it's Anthem. So what I would show the client is I would do add to compare. And then Connecture allows you to do a side by side. So I know Anthem's the one that's going to cover their drugs the best. So this is what I call the 0 premiums, I call value plans. The plans with a premium, I call enhanced plans. And really the only thing I do is I show them this number right here. The value plan has a $5,900 max out of pocket, or you can pay $28 a month and have a $3,900 out of pocket. So let me ask you a question, Sandra. If you got cancer, do you want to pay $5,900 or $3,900?
Honestly, 39.
Okay, they're going to take $28 out of your. I mean, that's it, guys. So once I establish which company's going to cover their drugs the best, their doctors are taken care of, they can use it at their hospital of choices. I always show them a zero premium plan and the enhanced plan and just ask them which way do they want to go. Because the biggest difference is, I know there's lower co-pays and more dental. Guys, if you haven't figured me out by now, do you think I really care how much dental they get when it comes to medical bankruptcy? I want to get them in the best possible coverage that gives them the least out of pocket if their health goes south.
Mhm.
And the number I always look at is this number right here. And I always focus on cancer. Why? For those of you who've been doing Medicare Advantage plans for a while, what is every Medicare Advantage plan going to make them pay if they do chemotherapy or radiation? What is it? Is it a copay or a percentage? And Sandra, you can answer too.
It's a percentage.
Right, it's 20%. So that's what I'm looking at, is if you get cancer, I mean, if you can go have a $500,000 in the hospital, open heart surgery, a heart transplant. On most of these plans, your worst case scenario is going to be a couple grand. But if you get cancer, that's why Medicare says about 95% of the people never hit the max out of pocket. Who are the 5%? It's usually cancer people. There's a few other things, but it's usually cancer. Not that it doesn't cover cancer, it's because chemotherapy and radiation is a 20% coinsurance. And so most people are going to hit that max out of pocket.
Mhm.
Now, I know we can throw cancer plans on there and stuff, but the bottom line is, do you want to pay zero? Because there are some people that don't want to pay a premium. They're just going to pay more if they get sick. And there's other people you can pay a small premium and have the best possible coverage if you're sick. Which one are you? Because I could care less which one they go with. We all get paid the same. They're both good plans. It's just their preference. But I always just focus on this number here, which is kind of the same thing I focus on the ACA. It's not the deduct, it's the max. Guys, that's the most important number on any health plan. What's my worst case scenario if my health goes south?
Yep.
And then what are you willing to pay?
Couple questions in the chat. First of all, can you email a client from Connecture? Cheryl, are you thinking like, can you email them the application, or what's your question?
The comparison that he was just showing.
Yeah,
Oh,
so
the
let's do
comparison.
this comparison. Compare now. So let's go back here. Send quote. So you put it in and it's going to show both of these plans. And it's going to include a personalized video explaining the difference between these plans. So let's.
I actually tested that and tried that. And I think Sandra, you and I had talked about it. I tried sending it to myself and it would not email. So I don't know if I was just having trouble with my Connecture, but it would not send that. And Sandra, I think you said you didn't think you
Yeah.
could do that.
Well,
There was
I've
a
never
time
tried
where we
it.
couldn't.
Yeah,
Okay.
Yeah, when there was the big data breach and all that kind of stuff, we
you
couldn't.
couldn't email
Now we
anything.
can again. So
And then make sure you tell them they're going to get a code on
Right.
their cell phone that they'll need.
all right, so this is the
Yeah,
email.
that's
That's
okay,
what it
good.
looks like. So it says view quote. Now the other thing is you're going to get a text with a code. So let me get that in there. Q7V 5T K3.
And
Ah.
Jeff, you can actually also talk about hospital indemnity as well, as long as they've checked that on their scope of appointment form.
But can we add that to the comparison, Sandra, or is that a separate discussion?
I don't know, Steve, can that be added to the quote?
We'll look in a second here.
Yeah, we'll look. Good question.
Oh crap, I forgot what I put as my date of birth for this guy. Hold on.
It was,
How old is Medicare
Let's
exactly?
find out.
was 59 was the year, but I don't remember the rest. 415, 59.
4/15/59, there we go.
Tax day.
All right, so basically that comes in, so it's got the information, it's got their doctors, got their drugs, they can make sure, okay? And then it's got the side-by-side comparison,
Okay.
okay? They can go back and shop these plans if they want,
Mm-hmm.
okay? But let's see. Can you hear my video?
Hello.
Yes.
Yes.
Based on our conversation, we've determined that a Medicare Advantage plan would best suit your needs. Let's compare the details of each plan. Here are the general plan costs. Let's look at which of your providers are in network for each plan.
That's cool.
Yeah.
Yeah, that's very cool.
And now let's look at how many of your prescriptions are covered for each plan.
That's nice.
Mm-hmm.
After reviewing this information, you can begin the enrollment process by selecting Add to Cart. Or to view more information about a plan, click View Plan Details. If you'd like to change any of your preference information, click this button. If you have any questions or concerns, a licensed sales agent can be contacted with the information on your screen.
I'm sorry, but that's freaking cool. I don't know how they do that, but it's amazing. So going back to Jeff's question.
Yeah, if you could add in hospital indemnity to the quote.
Hey, Kev, I have a question.
Yes, ma'am.
Sorry, I got a phone call and you may have said this, but I just wanted to see, are you kind of doing the shopping comparison between different companies prior to showing them the side by side for Anthem specifically? Or do you ever send mixed loaded quotes like Humana versus Anthem or United Healthcare versus Aetna or whatever?
Yeah, I'll show you what I do in a second, but I just want to.
I just didn't know if you've heard anything, for 2025 against that.
Yeah.
I don't want to send something out side by side and it's two different carriers and then the secret shopper.
Says you're not allowed to do that. Right?
Yeah.
Yeah, we don't
Yeah.
know. I've not done that before, Michelle.
Okay. I usually try to wean it down to the carrier that I think is the best. But if they're in person, I
Mhm.
might show them, this is what I thought and this is why I thought. But if they ho-hum or whatever, I'll say, well, I'm not pigeonholing you in any one particular carrier. I'll show you the other ones if you want. But
So
for
going
time,
back, going back to Jeff's question, you can't even do Chesapeake. Oh, is it the Chesapeake here, Gary?
Yeah, that's it right there.
But see, you can't custom design it like you can.
Mm-mm.
So
Right.
that's always something I would do through Quote Connect.
Hey,
Unless-
Steve, I wonder,
unless-
Steve, you selected Medicare Advantage only versus MAPD
I did.
Back-
That's,
plan type.
yeah. Because I never use this tab, so I got to be honest with you, it's the first time I've seen it. Okay, there we go.
Yeah, there we go.
And which one? No. Let's
Just do,
say
yeah,
that we're
do
going to go with
two.
the Advantage.
Go, yeah, I want number 2.
Okay.
And then when you clicked on plan details, where's the, well, that's interesting.
Okay.
Is that where you customize it? The ambulance transport, and I think that's where you customize it.
So I'm just going to set it up the way that I usually do it.
Mm-hmm.
Yeah, this is actually
You
pretty,
can select the different types of coverage that you want within it, but it automatically defaults to the same amount on the plan that you've chosen.
right. Yeah, so that's, so add to the cart. So it doesn't look like you can we put it on the quote? Because that was your question, Jeff, right?
Yeah, can you put this with the Advantage plan quote?
So there's the Medicare Advantage plan quote.
And can you go?
So
and-
add to compare rather than cart.
Okay. So it looks like it left everything the same.
Mhm.
Yeah.
So it looks like it's only given me the option to add to cart.
Yeah.
Hmm.
Have to kind of play around with it, maybe, Jeff.
So you might have to send two different ones, or
Yeah.
again, use Quote Connect. I mean, they're going to make some changes to this next year because
Mhm.
guys, Quote Connect's going away in January. We're gonna have Health Sherpa, so we don't need it for the ACA anymore. And all the CLECO products are being transitioned into Golden Rule, and they already have a quoting thing. So I don't know how this is all gonna incorporate. So
Yeah.
for the time being, I would still just use Quote Connect for all this stuff
Mhm.
and just use this for your Medicare. Okay.
All right, thank you, Steve.
And that's one of the things and I know Silas is fighting for that, is can they create something on here that we can do like that 3-panel approach where we can start adding things from different categories? Because right now we can't.
Mhm.
Okay. So again, going back to Michelle's question, what I'm actually doing right now is when someone schedules, I'll just kind of do a quick little run through. Matter of fact, I'll just do one right now in real time. So as you guys all know, I'm sending out emails and stuff to people. So here's someone scheduling their own appointment. I know she's Medicare.
Mhm.
So when I hit view appointment, I have an email that I call Medicare Retire Flow. And it basically says, in order to properly serve you, I need to complete a Medicare required form. So I'll be ready for your appointment. If you have a spouse that wants to this class, they need the same thing. So when they click on this, it takes them to Retire Flow. I don't do my Retire Flow inside Connecture. I do it here. And so when I go to Retire Flow now, because I've been using Retire Flow a few months before it was even announced.
Mhm.
So like, I mean, I already have 125 downloads on Medicare. These are all drugs, doctors, scope of appointments that I already have. So when it comes in, so here's one that I literally can just hit this, it'll open up. So I have two screens here. So I'll have my Connecture open. I'll just go to the person. I'll just verify the pharmacy. I'll verify the drugs. She's got a lot.
Mhm.
And then I'll put in all this stuff. So then going back to Michelle's question, when I talk to her, I already know the carriers I'm showing her. Because based on your information, the plan that's going to cover your drugs the best is United Healthcare, Humana, Aetna, all your doctors. So guys, think about a Medicare appointment where there's no data entry. There's no worrying about the scope. Because the beautiful thing about the way that I'm doing it, when someone schedules a Medicare appointment in my full slate, I'm sending them the scope of appointment. So I want you to think about something for a second. Okay, so this is my October 1st. When I go here, it shows right here that she scheduled an appointment on September 4th. I sent her an email for a scope on September 4th. Even if she doesn't fill it out when we get together, I'm bulletproof because she scheduled the appointment. So that tells Medicare she wanted to talk to me. And I have a timestamp showing that I sent this to her. So then when we do the appointment, if they haven't filled out the scope, I can do the scope right there and just put the client scheduled her own appointment. I sent the scope of appointment. She did not sign it. So we're signing it right now. Totally protected.
Yep, you just put that in the comments section on the scope of appointment and you'll be fine.
Yeah, so when I'm in Retire Flow, let's just say I'm meeting with this guy. He didn't fill it out. All I have to do is hit this if it's in person
I did not know that.
Mm-hmm.
and just fill it out. Or if I'm doing it over the phone, I can do it there.
Yep.
And now I've got it.
Yep.
But most of the people are filling it out based on the technology. So guys, when I'm telling you guys, having a scheduling site, not only does it save you time, but with the technology we have, it's making me compliant.
Right.
Because now, I mean, guys, look at this. Let me go back to this for a second. Okay, this is the first week of October.
Your
That's the
pre-AP.
second week of October.
Mm-hmm.
That's the third week of October. That's the fourth week of October. And now I just did the under 65, and now I'm starting to get stuff filled out then. But guys, think about this right now. It's early in September. I sent one text, one email, and a voicemail, because again, I use slide broadcast. So I sent one email saying, I sent a voicemail saying, I'm going to be sending you an email and text, get on the schedule. Then 15 minutes later, the email went out, the text went out, and I set it all up and it did it automatically through Constant Contact and Simple Text. I am now booked solid through October without talking to a single person.
So
And
even
then
if you
yes-
don't have as many clients as Steve, it's still a really efficient way of running your business.
Because do you want to have to start doing all this when you have hundreds of clients? Or do you want to learn the behavior when you have 15 clients? It's just the right way to go. I can't stress enough having a scheduling site,
Mhm.
being able to email that link for them to do it themselves, and then using Retire Flow either through Connecture or outside of Connecture to get the compliance. And it's the same thing too. So let's go into November. Okay. Let's see here. Okay, this lady here I know is health insurance. Guess what I have for health insurance? I also have the Retire Flow for the ACA, which means when this comes back, do I already have the ACA consent form? Guys, I'm just telling you, I'm getting all this stuff a month before I need it. So I'm always compliant.
So
without
there were a
having
couple
to worry
questions.
about this.
We're kind of getting off topic from part D
Mhm.
because we're actually getting in more to how do you work more efficiently and effectively, work smarter, not harder. A
Mhm.
couple questions. And remember, Steve started Retire Flow before it was even available through Connecture. So are you as you receive the Retire Flow submissions, are you entering them now into Connecture? If you
Yes.
haven't signed up for Retire Flow, though, you probably should do it through the Connecture link.
Yeah. I mean, if you do it through the Connecture link, it's going to pull a lot of that information in there for you. But yes, when one of these comes in, so again, these have been coming in. So once I cross-reference and make sure everything's up to date, I will just put in DE, data entered, and then I just move on. So when I'm in between appointments, like I said, I have two screens. I have their Connecture open. I have this. I just cross-reference.
Yeah.
and I move on. So it's just,
Yeah.
I'm just staying on top of this.
And
I
Emily,
saw that status section just today when I was looking at mine, and I wasn't sure what it was supposed to represent or what I was supposed to put in there. I was
Yeah,
actually
so
just
here's
looking
one.
there.
These are two people that I haven't entered because they filled out the thing, but I don't have their date of birth. So I've got the appointment, but yeah,
yeah. And as far as using a scheduling tool, Emily, and I know you go and do a lot of face-to-face when you travel, you can schedule your appointment blocks, so it does allow you time to travel in between those, so.
yeah, I basically, if everyone that wants me to meet them face to face, we have to talk. If you want to come to my office, Zoom, just schedule it. But I have a link on there on the phone call that says, if you want to set an in-home appointment, call me, then I'll schedule it and then I'll block out drive time.
Yeah.
Okay. So I know we kind of got off on a tangent, but again, it's just this whole idea of embracing technology is going to make your life so much easier. Now, is this something you want to set up 2 weeks before October? No. This is something that, okay, in January, I'm going to start dabbling in this a little bit.
Yeah.
So I know I kind of went on a little tangent there,
Yeah, but you're okay. We're flying by the seat of our pants today. Yeah, so
we call
cool.
that in the business filler.
Yeah, filler. Hey, well, I've got more filler for you.
Okay, well,
You have to stop sharing.
here we go. How's that?
Awesome. Thank you.
Yep.
All right. So where am I? Okay, right here I am. So you guys can see my screen.
I got one thing to say because Mac's on here. So Mac,
Yeah,
can I talk to you for a second.
go ahead.
Okay.
Hi, Steve.
Hi. Will you please tell Plagans to learn how to do a freaking application on a computer? This paper stuff's ridiculous.
You
That's
know
all
what
I'm
might
saying.
make
That's all I'm saying. He needs
was
your
still
help.
doing-
Please
He was
help him.
still doing paper applications. Oh my God.
you want to
So-
know what's funny? He does them both. Does the paper app and then goes to the portal and types it all in there anyways.
Oh,
He's a funny
gosh.
guy.
Oh,
Big
That's
waste
how- you
of
know
time
what?
is what it is.
hey, he's been successful, right?
It works.
It-
Whatever he's
whatever
doing, it
works.
works.
There you go, whatever works. So, with the last, time remaining we have that, we'll go over some Medicare and group insurance. And then Steve, if you wouldn't mind monitoring the chat for me, that'd be awesome.
Yep, I gotcha.
Alrighty, so some things to consider when we're first talking about Medicare and people that have group insurance. Typically, people say, okay, I have Medicare and group insurance, which one pays first? Well, in this situation here, the primary payer pays up to the coverage limits and the secondary payer pays the remaining balance. If the secondary payer doesn't cover the remaining balance, the patient pays the remaining balance. So the question is, one is Medicare primary and the group secondary, or vice versa. So if you're 65 and older and have group insurance through an employer with 20 or more employees, your group health plan pays first. If your employer has fewer than 20 employees, Medicare pays first. Okay. And we're going to talk a little bit more about the 20 employees because, as you'll see, if the employer has fewer than 20 employees, the employee needs to enroll in Medicare Part B to avoid the late enrollment penalty. Just because they have group insurance, if they work for an employer that has less than 20 employees, they need to sign up for Part B. Otherwise, they will incur a late enrollment penalty when they're ready to sign up for Medicare Part B. If you have, if you're under 65 and have a disability and you're on Medicare because of the disability, and you have group insurance, maybe perhaps through your spouse, it's an employer plan. If, again, with more than 100 employees, your group plan pays first. If your employer has fewer than 100 employees, Medicare pays first. So that's a little bit different. That's only for those that are on Medicare due to disability. End-stage renal disease, kidney disease. If you have renal disease, your group health plan pays first for the first 30 months after you become eligible for Medicare. And then on the 31st month, Medicare becomes primary. If there are some people, they have a retiree health plan, right? And they also are enrolled in Medicare. If they have a retiree health plan, Medicare pays first, the retiree plan pays second. And then if you have COBRA, I added this in here. People think, oh, I'm still on my employer's plan, it's COBRA. I don't need to sign up for Medicare. Well, that's not accurate. They don't view COBRA as being creditable coverage, even though it's basically the extension of a group health insurance plan. So if you have COBRA, whether you're turning 65 or even older, you do need to enroll in Medicare Part B to avoid the late enrollment penalty. Okay. Some other examples of how Medicare and group work together. So special enrollment periods. If you retire or lose your employer health benefits, you have an 8-month special enrollment period to get signed up for Medicare Part A and B, and you will not incur a late enrollment penalty. Okay. If your employer plan has creditable prescription drug coverage and you no longer have this plan, you have a special enrollment period to enroll in a Part D drug coverage plan of some sort without having a penalty. And why do I emphasize this? There could be a group plan out there that doesn't offer prescription drug coverage. And so if you don't sign up for your Part D benefits at that point, you could incur a late enrollment penalty later on because your group plan didn't have any prescription coverage. Your group plan has to have prescription coverage that is at least as good, if not better, than what the Medicare structure is. I have run into that situation. So when could it make sense to not move fully into Medicare and stay on a group plan? There's a couple reasons. Perhaps the employee has a younger spouse who needs coverage. Maybe they need a private ACA option that's usually available, but perhaps maybe they've already met their max out of pocket for the year and they're going to stay with that group plan. It could be better than going on to the Medicare option at that point. There are other special circumstances like the end-stage renal disease prior to age 65 that perhaps the group coverage is actually going to be a better option for them. And the other thing is that if your group plan is an HSA plan and you are contributing to an HSA and your employer is contributing to the HSA, the IRS states that you do not want to be enrolled in Medicare. So that's what this slide is. It's IRS publication 969. To be eligible to and qualify for an HSA contribution, you must meet the following requirements. And one of the requirements is you cannot be enrolled in Medicare Part A or Part B. Now, I'm not the IRS police. There have been situations where people have signed up even for just Medicare Part A only. They're still working. They still have their group insurance. Their employers putting contributions into their HSA. They're putting contributions into their HSA. But technically the IRS says that's a big no-no. And, but again, I'm not the IRS police. I just know what the publication says. But let's just say they do decide to drop their group insurance. They haven't been contributing to their HSA. There are other, they can still use the funds in their HSA. And there's stipulations on how they can use their funds too, even for some of their premiums for Medicare. So the link is here for the IRS publication. And whenever I'm talking to an employer group, and I know they have an HSA group health insurance plan, this is one of the things I do talk to them about. Any questions about that before I go on?
I have a question.
Mhm.
On the retiree plans, so when you mentioned about Cobra, that you like that, they have to sign up for Medicare, because that doesn't count as their group plan, so they have to sign up. And same thing for retiree plan, right? So like if they have, so that was confusing to me because like, say like a union plan or, you know, people that have, why would they pick up Medicare and pay for that if they've got full coverage on their retiree plan?
Medicare pays first, and because if they don't, they're going to incur a late enrollment penalty.
But so they would, I mean, so if they have a retiree plan and they don't need, I mean, so they would have to be on Medicare. Medicare pays before their retiree plan?
That is correct.
Okay.
Yep.
Okay.
Yep. Yeah. And if they sign up later for Medicare, and let's go back to that slide. If they have a retiree health plan, we're not talking Cobra, we're talking a retiree
Right.
health plan.
Right.
Medicare pays first. But if they don't have Medicare and they haven't signed up, guess what? They may
Then
be
they pay the
incurring a
penalty.
late enrollment penalty.
Okay, so like anybody like on a union plan or like the county or with all
They have Medicare. Yeah.
that's interesting because that is not what, okay, I might
Yeah.
need to talk to you later.
Sure.
Okay, thanks.
Yeah. So,
Sandra, could we go back to that slide,
mhm.
that slide you had up? That last, no. Let's go closer to where you're, the slide before the one you want to show next. Yeah, right here.
HSA.
That last line that says enrolled in Medicare Part A and Part B, should that be and or?
Yes, I'm sorry. Yes, it should be and or. Yes. They cannot even be enrolled in Medicare Part A and then make contributions. So I'll make a correction on this. I was, like I told Steve, I said, we're flying here. So I put this together really fast, but I'll make a correction. But yeah, because there are some people that think, oh, I should just go ahead and sign up for Part A because it's not going to cost me anything. But if they're making contributions into their HSA, they do not want to sign up for Part A. Thank you, Jeff. I'll make sure I make that correction.
Thank you.
No, I appreciate that. So I missed Mr. Plagans talking about veteran benefits. And so I will share just a few things that I do know about veterans. And I always appreciate, first of all, the service that they've given to us, and always thank them. And so what about veterans? Well, first of all, I do want to make sure that when I'm meeting with somebody new, especially, I do ask if they have access to VA benefits. Have they ever served? Just to find out. And sometimes they have served and they don't even know they have VA benefits. They haven't even checked into it. So I do encourage them. There are VA liaisons in every county. And so I just encourage them because they have access to these benefits. And I want to make sure they're getting those, whatever they deserve. So the veterans are people who have access to the VA benefits. There's a division called TRICARE or CHAMPS VA. They have additional coverage and benefits available. Veterans should contact their local VA office to find out more about what they are entitled to. And there are some private carriers that offer special Medicare Advantage plans specifically for veterans. And you'll see them listed as MA only plans, Patriot plans. I don't know what's a couple others names, but you'll see those. And they do not include prescription drug coverage typically, because if you have VA benefits, you have access to prescription drug coverage. But we're going to talk about that. Having Medicare means you're covered if you need to go to a non-VA hospital or doctor. The VA system will tell every veteran, please sign up for Medicare Part A and B. Don't not sign up for it. They want you to have it. You have more options to choose from. And funding for the VA healthcare could change in the future. And they actually encourage everybody to sign up for the healthcare benefits that they're eligible for, so they have options if they need them in the future.
Sure.
Oh, I'm gonna mute.
I'm sorry.
That's okay. Tanya, can you mute yourself? Thank you. Now,
Do-
if they-
Excuse me, Sandra, does VA status provide creditable coverage? So if they don't have Part A or B and they enroll later, would they incur the penalty?
they will incur the penalty. That's what I was saying. If they have VA benefits, they failed to delay signing up for Medicare, they're gonna incur a late enrollment penalty. You see my slide?
Okay, okay.
Yep. This
All right.
penalty obviously gets bigger each year they've delayed. It's a 10% penalty for every year you haven't been enrolled. And that's why I said, please sign up. Now, if you sign up for a Medicare Part D prescription drug coverage plan, you'll be able to use it to get medications from non-VA doctors and fill your prescriptions at local pharmacies instead of through the VA mail order service. There's no penalty for delaying signing up for Medicare Part D. And maybe this is what you're thinking, Jeff, but there's no penalty for signing up for a drug plan when you have VA benefits, as long as you enroll when you're first eligible or within 63 days of when you no longer have VA health coverage or other credible coverage. Okay.
No, I have a couple friends that refuse to sign up for Medicare Part B because they don't want to pay the $175.
Yeah, so I have a story to share. So I had a gosh, it's a heartbreaking story. A former client of mine, she called me crying. They were on their way back from Fort Wayne. And here's what happened. Her husband had VA benefits. He was enrolled in Part B. And his level of VA benefits was kind of based on just service, but also their income. There's a lot of different levels of VA benefits, and I'm not the expert there, but I know that some of them are income based. Well, she ended up taking a part-time job, which ended up causing them to be over income for the level he was at, and he lost his VA benefits and didn't realize that when they got to the VA hospital. And in the meantime, he had thought, hey, I have VA benefits. What do I need Medicare Part B for? And he voluntarily disenrolled from Part B. And so all he had was Medicare Part A. He had nothing else. And so they're on their way back. She calls me and she says, what can we do? Can we get him signed back up? Can we, it's like, oh my goodness. It was definitely a very difficult case. And that was at the point where we had a very specific general enrollment period for getting signed back up with Part B. And, but it wouldn't take effect until July 1st of that year. I couldn't get him a Medicare supplement plan. I couldn't get him a Medicare Advantage plan. I couldn't get him anything. It was a rough case. So, yeah, unfortunately, he ended up passing away. But I even called, oh gosh. Who's our guy at Humana, Steve?
Jack or Dan?
Mike.
Mike, thank you, Mike Jones.
Oh,
I
Humana.
called Mike. I was
Sorry,
just thinking,
thinking Aetna.
no,
Sorry.
that's okay. I called Mike. I said, Mike, what can we do? Is there anything we can do? He said, oh my God, no. He goes, the VA, they need to have Part B. Why did he disenroll? And I said, I have no idea. His wife didn't know. So it was really a very sad case, but there really wasn't anything more we could do for that. But please know that sometimes they may want to sign up for a Medicare Part D plan because the VA is very good at covering certain medications, but maybe not others.
Sandra, isn't there a Medicare general enrollment period though that they could, were you saying that he wasn't eligible for that or?
Yeah, so how it was back when this all happened. is
Oh,
the
okay.
The general election period was January 1st to March 31st. You
Right.
sign up for your Part B, but it doesn't take effect until July 1st. Now they have since changed it
Yeah,
that you
okay.
could still sign up and then it becomes effective the next month.
Okay, that's,
So.
thank you for clarifying.
Yeah, and when you do lose your group coverage, your employer is supposed to send you a notice of creditable coverage, and you want that. Some of the carriers may ask for that letter. Because also if you're like signing up for certain carriers and their Medicare supplement plans, they'll get issued as guaranteed issue because you had creditable coverage. So what else can I say? Part D, if we have delayed enrolling in Part D benefits, whether it's a standalone drug plan or a Medicare Advantage plan, the carrier will send the client a form asking them to fill it out to say what type of coverage did you have? Did you have group coverage? When did it end? Again, that's so that they avoid the Part D late enrollment penalty. So when I have somebody that's delaying taking Medicare and they're signing up for their benefits, whether it's an Advantage plan or a Part D plan, I let them know, hey, your carrier is going to send you this letter. The best thing to do is just call the carrier back, give them your group information, even though the person has filled out the Medicare Part B enrollment forms, because remember, they've delayed taking this. If that information doesn't get transferred over to carriers and things like that. So it's just another step, another thing to advise your clients about for signing up for Part D or an Advantage plan if they've delayed it. I feel like I'm talking in circles. Nope, I'm good. Okay. Trying to think
Gotta
of other
repeat things
things.
3 and 4 times, remember?
I'm
In
sorry,
order
what?
for it to absorb.
What did you say? No.
I said you gotta repeat things over and over for them to absorb.
Yeah, it is so true. And you think about the work we do is so important because look how complicated this is. Who designed something like this? But our clients need us. And the more we can help educate ourselves on it, the better. So yeah, absolutely. That's the request that's the Part B enrollment forms. Yeah. So CMS does have 2 different forms that somebody has to fill out when they are signing up for Part B. One is the employer verification form and one is the request to enroll in Medicare Part B. I have those forms. I give those to, I help my clients with those. And I advise them, how do you sign up for Part B? How do you sign up for this? So it's just part of our service.
Sandra and Cab, do you guys sign people up for Part B? Do you help people with the applications normally?
I don't help them with the applications. I give them the applications. I instruct them how to fill that out and take them to their Social Security office.
I just feel like, especially people who come to me earlier, I'm constantly telling them, SSA.gov, register, get on there, create your account. And
no, the thing
a
is,
fraction of them do.
Yeah. And, we guide them there too. I do give them the forms though, because 9 times out of 10, Social Security still wants their signed form. And also there's a difference. If they physically fill out the form and take it to a local office, it's processed in a different manner than when they sign up online. And when they sign up online, it goes to an office in either Philadelphia or California. And if they're doing it within the 4-week window for when they want their Part B to start, it's a really tight window. So they're able to track the applications better if they're submitted at the local level.
Yeah, I send them to Social Security. I don't do that for them.
Yeah, I don't want them doing it online. I'd rather have them go to the Social Security office.
I've had people who go to the Social Security office in Michigan specifically, but and they basically turn them away and say that they need to go fill it out online.
I think it just depends on the office. Yeah.
Yeah,
So
it's
Seth, you
crazy.
had a question?
Yeah, I'm kind of new to this, so
Welcome.
I have a gentleman who, I mean, Derek explained to us to do it online. And this guy is not proficient with getting his emails on his phone.
Mhm.
So are you saying that there's a piece of paper we can print out before they even go to the Social Security office?
Is this somebody who's new to Medicare turning 65?
Yes,
That's
yes.
different. I'm talking about somebody who might already have Part A in place and needs to sign up for Part B.
Okay, so if they're just turning 65, they either have to go down to the Social Security office without paperwork already.
Yeah, they don't need any paperwork.
They just need to go there.
They can go there. You know what? They can call and enroll over the phone.
Okay.
If they're not computer proficient.
Okay.
Yeah. And then they can also sign up online as well. That's different. Yeah.
Okay. Okay.
Yeah.
Thank you.
Yeah, you're welcome.
I think the big thing here is getting the Part B after you're eligible. They need to do it at the office, because if it goes wrong, and it's what I'm dealing with, what I mentioned earlier, if they don't fill it out and get it done in a certain window, they're going to have to go to the general enrollment period, which is January, February, March of the next year. And then they can't get their B until June or July. Is it July? July 1st?
Well, now they said if you do it in January, it could possibly go into effect February or March.
Okay, I didn't hear that, but in the
Yeah.
past, it was you did it during those
Yeah.
first 90
And
days.
then it didn't go into
Wait.
effect till July.
Yeah, so, and again, guys, I'm just one of the big things. I probably shouldn't be saying this because Silas is going to probably get mad at me, but I don't hold my customers' hands. If it's something that it's at another agency, let the other agency do it. Because again, if something goes wrong, who are they going to throw under the bus?
Right.
Mhm.
You, the guy who's handling it.
Nope, I just advise them where to go and what to do, and they have to take care of it.
So how soon can they enroll for A and B before they turn 65?
3 months.
90 days.
90 days. Yeah.
Days.
That's
Okay,
when they can start the process.
not with us, but I mean as far as with SSA.
Yeah.
90 days.
3 months.
90 days.
Okay,
Yeah.
It's that initial enrollment period. It's the 3 months before they turn 65, the month they turn 65, and the 3 months after.
Mhm.
So if they go to Social Security and it's 4 months out, they're like, come back in a month. You're not even in your enrollment period yet. So now
Right.
that's only if they're not drawing Social Security. If they're drawing Social Security, they're going to get their card at that 90 days and they're done.
Yep.
So that's the big thing when I'm talking to my customers that are getting close.
Mhm.
Are you drawing Social Security? Yes. Okay. You don't have to do anything. When you get your card, call me.
Yep, I just.
No,
let them
I'm
know
not.
you're
I'm going to wait
interested.
till I'm 67. Okay. You need to go to the Social Security office 90 days out and you need to sign up for Part B and let them know you don't want the income, because the big confusion is Medicare and Social Security are the same thing. They're not. You sign up for them at the same place, but I always explain Social Security is income, Medicare is health insurance.
Mhm.
They're not related, because I get people, hey, I just turned 62. Can I get on Medicare now? No.
Yeah. I just say that Social Security is the gatekeeper.
Yeah.
They are the gatekeeper of all things.
But then again, when you've got those people that are thinking of, because I get a lot of referrals from Edward Jones where people are like, I'm going to retire. I got a guy coming in tonight. I'm going to retire at the end of the year. Very first thing is, are you drawing Social Security? No. Well, then you need to go 90 days before you want this to start. Or if we're in that 90 days, you need to go right now and get signed up with your B. And as soon as you get the letter or the card, because they'll get one or the other, they'll either get a new Medicare card or they'll get a letter stating when it's going to start. It's probably the letter they get first. Said, as soon as you get that, call me and then we can get you signed up. And I'm out of it at that point. I don't get online and help them do it. And I used to do that kind of stuff. And I mean, setting up an account on SA, it's like you're being interrogated by the CIA. I mean, it's horrible.
Well,
You got all kinds of different identity stuff, and it turns into like a 3-hour ordeal. And then once you finally get the SSA account, to sign up for Medicare takes 3 minutes.
yeah, well, there's a way to do it online for just signing up A and B too, without going through SSA.gov too. That's the one that I've helped them with. And then I put the enrollment as like the assister or whatever, you know.
I
But
don't do that, yeah.
But
Nope.
again, I punt to Social Security because I don't want any of that hanging over my head.
Mm-mm,
sure,
mm-mm.
I get it.
Yep, yep.
I
So
know
what-
we all struggle with agents as we gotta be all things to our agents, and I'm telling you, no, you don't. 'Cause
No,
if you adopt that mentality, it will come back to bite you in the butt because you said you were gonna do something and you didn't do it right,
mhm,
and now they're throwing you under the bus. Where you were doing it to be the nice agent, your nice agent got you a complaint with the
I
government
know.
because
So-
you're doing something that you're not. How many of you work for Social Security office? Any of you?
Nope.
Then
How many
quit
work for
doing their
VA?
job. Quit doing their job.
Yeah,
Same thing. How many of you work for United Healthcare Insurance? How many of you work for the insurance company? Quit doing all their customer service for them. I know that's taboo, but I'm telling you, I talk to so many people who have to have insurance for all the customer service crap they're going through, and I don't have an assistant because I don't have any customer service
yeah.
because I
It
set
is.
up the customer service department.
It is time consuming, time
It is.
absorbing. It's a time sucker. And I'm sorry, Mac, you feel like you work for the VA. Yeah, and you don't work for the government. You're absolutely right, Mo. We're here to help provide advice and counsel and guidance, help them enroll in a product, help them understand their benefits. But when it comes to all that other stuff, I have no worries about, hey, here's who you need to call.
Yeah.
And I'm empowering them to do it.
I'm telling you guys.
And
the
if
best
there's somebody that seems to be kind of confused, I usually will also ask, do you have a family member that helps you?
Yeah, I have
I'm
found
not their
the
family.
best customer service where I get the most thank yous
Mhm.
is here's the number to call, here's your policy number so they can find you, and here's what you ask them.
Yeah. So,
That's my customer service. I'm not doing a 3-way call. Now, again, I got to put a little disclaimer on this. I do customer service. I pick and choose my battles. If
mhm,
they're in the midst of a huge claims issue, I will meet with them. We will call the insurance company. I'll hand them my phone. Yes, you can talk to Steve, and then I'll get involved.
yeah,
But I'm not doing their change of address. I'm not doing it because they have a new credit card. Let someone making $15 an hour at Humana do that. You guys don't get paid to do customer service. You get paid to tell people the right plan. And I'm telling you, because I went out on a limb 5 years ago and everyone said I was stupid as hell.
Hmm.
I made a decision. I'm no longer going to do customer service.
So Casey.
Here I am. I'm still doing good. How's my schedule looking? Am I losing anybody?
Yeah, I don't know. Are you? You're losing your hair.
Well, I did that on purpose.
Hey,
'Cause
Casey.
I want to be like Seth.
You need more facial hair then, Steve.
No, I can't do that.
How long do they need to be drawing their social security benefits before the automatic switch flips where they're automatically enrolled in Medicare? I don't have a clue. Couple months? I'm not the social security office. I have no idea. Yeah.
What was the question?
Yeah, I guess
How long
the
does-
reason I ask is because you know, if I sit down with someone who signed up for Social Security last month and they turn 65 next month, I don't want to, you know, tell them, yeah, you'll automatically get your card in the mail if that doesn't happen that quickly. You know, I was just curious if there was like a set time period that they should be drawing Social Security before they're automatically enrolled 3 months before their 65th birthday.
If they have been drawing Social Security before the 3 months, they're gonna get the card.
Awesome. Perfect.
If it's a
Thank you.
situation to where, you know, I'm gonna get my Social Security when I'm 65, that happens a lot. I don't want to draw it till I'm 65. You have to go into the Social Security and set that up.
I've also seen where I've had a client say, hey, I want to start drawing my Social Security benefits in October, but they don't turn eligible yet for Medicare until November. So it sort of like triggers it that way too. They, for some reason, so Social Security knows, okay, they're going to get their first Social Security check in October. They're going to send them their, but I always let them know, hey, if you don't have your card yet, call. Absolutely. So there was another question or a comment, Jeff said. Online initial Medicare application is a two-step process. Complete step 1 and wait for the letter to come from SSA, and then step 2. Okay, it can span 2 to 3 weeks, so don't do online if you need Medicare next week. Well, yeah. We're talking about a government process, so. Other questions related to Part D, other coverage, VA benefits? We know enough to be dangerous.
Sandra,
Yes, ma'am.
just to clarify, because I was going over this with Ray last week actually about the credible coverage with the VA. So you're saying, just to clarify, if they're a veteran and they turn 65 and they do nothing and they just have Part A, they do get a penalty for Part B.
If
And Part D?
they get a penalty for Part B.
Okay, because the Part D
B as in
kind of still would
boy.
be credible through the VA, correct?
Yeah, that's considered creditable coverage. VA drug coverage, credible.
Yes. Okay, I just wanted to double check.
VA coverage for medical, not considered creditable.
And
Sandra, on the
Sandra,
group-
I gotta ask a question because I kind of was doing some other things when you were going through it, but as far as the whole credible coverage being on a group plan, they have to let out they have to let them know it's credible coverage. And the rumor on the street is that because the drug plan's going down to 2,000, a lot of the group plans are no longer going to be considered creditable.
Oh,
So when you're sitting with these people that, should I stay on my group plan? Should I not? They need to understand if you, and again, the company has to let them know it's not creditable. They may get dinged with a Part D penalty once they get off the group.
yeah, that's a good point. I didn't even think about that.
Yeah, because if I'm on a health plan with a $5,000 max out of pocket,
That's not as good as Medicare.
no.
So that'll be the same if they stay on their group plan even after 65? It'll
Yeah,
be,
because it's not
Yes.
considered
They have
creditable
to mention-
coverage.
okay.
Yeah, yeah. So
It's not
that's
as good as Medicare's coverage. And so, I mean, people are going to have to make some pretty tough decisions, you know, and again, I know that's that situation where, well, but my wife's only 62 and all. That's where we come into play on, are you better staying on the group, or should we get you on Medicare, get her on Obamacare, just get out of the group?
yeah, yeah.
Because
Because
there's
that
going
is
to be some penalties for staying.
on group.
Because again, in the past, when I had someone on a group plan, the only time I told them to stay on a group plan is if they were on really expensive drugs, because a lot of times it was better because of the donut hole. That's not going to be the case anymore.
Right.
Mhm.
And
In
that's where
Medicare, I can always sit down with people, and in most cases, somewhere Medicare is better than your group plan.
Yeah, and this is gonna be interesting because assuming, say their group plan is not an HSA plan and they're not contributing to an HSA. So they sign up for Medicare Part A, but their group plan has, like you said, a $5,000 max out of pocket. You could, and they turn 65, you could sign them up for a Part D plan at that point.
Mhm.
They could still delay taking Part B, but they should sign up for a Part D.
I have a question on the Part D. So if somebody takes a MAPD and they were a late enrollee and they had like a 0 premium on the MAPD, would they be getting charged then a late
Yes.
Okay.
Yes. Yep.
And
And
guys,
you'll notice that if you've done some of the, well, it'll still ask, how do you want to pay for your premium?
Right.
It's a 0 monthly premium plan. How do you want to pay for your premium? It's because they're going to look back and say, should this person be paying a late enrollment penalty on top of their 0 monthly premium?
and so
Okay.
you will get clients, because not all clients tell you the truth. I mean, you will get clients that like, hey, I thought I had a 0 premium and I'm getting this bill from Aetna for $17. What the heck's that? That's your Part D penalty.
Mhm.
And if you're not drawing Social Security, they're just going to send you a bill. If you're drawing Social Security, they're just going to take it right. So again, you could put someone in a $29 United Healthcare plan, but they have a penalty, and all of a sudden, why are they taking out 47 or whatever? It's
Mhm.
both. So
Yeah. Mac, you had a question about PDPs and the changes from the IRA?
The Inflation Reduction Act.
Oh, okay. Yeah.
I know that's the same acronym.
I'm
for
sorry,
other
I was
things.
thinking IRA.
So I took a screenshot of that 2025 changes to Part D phases and contributions. Because I am going to be focusing on prescription drug plans, helping Ray with that this year. And I just kind of want to know if this chart, because I know what we've been mainly talking about MAPD, if this chart is across the board going to be the same even for PDPs.
Yes,
It's all going to look the same.
yes.
and again, the big thing you need to understand, Mac, is learning how to read connecture
Mm-hmm.
and just showing them based on your drugs, this is how the plan's going to work. And then I always put in the little disclaimer. Now, this is assuming your drugs don't change.
Mm-hmm.
You get new drugs, all bets are off. I mean, but if your drugs don't change, this is what you're going to owe for the next year.
Mhm.
Okay, whether you're on a PDP or a Medicare Advantage plan. Okay. Can I add one thing about the groups? Because I'm actually
Yes,
doing something tonight.
yes.
The guy that came in, he's on his wife's plan. He's covered under her insurance. It's good insurance. The easiest way that you do this, guys, is what you need to do is, because a lot of people, they're like, well, I have really good insurance where my wife works. So I'm not going to go on Medicare. But when you actually say, okay, first of all, how much are you paying for that out of your check? And then what's your max out of pocket? So again, in this particular case, for him to be on her plan, I think it was $600 a month that's coming out of her check for him to be on there. And then they have a $3,000 max out of pocket. So you're talking, $7,200 in premium plus, so $10,000 for him to be on that good plan. I can put him on a Medicare Advantage plan for $174. And his max out of pocket is $2,900 with Humana, which is a better deal. $10,000 or $2,900. You see what I'm saying? Guys, always just learn to do the math with people. Insurance is not about deductibles, copays, all that. It all starts with math. What's my premium? What's my max out of pocket? It's called potential risk. When we go through training, we talk about that for the ACA, but potential risk works in Medicare as well.
Mm-hmm.
Okay. It's just figuring out what's the most cost-effective way for you to go. So now all of a sudden I can move him over to a Medicare Advantage plan for $174 a month. They're saving $500 now. What he's saving in premium is going to cover his max out of pocket if he gets sick. I mean, and they're just like, that's kind of a freaking no-brainer.
Yeah.
Yep.
Do the math.
Do the math. Did I ever tell you how I learned that? You guys ever hear that story?
No, I don't think so. Have we heard that?
No.
When
No,
I
don't think so.
started, okay, I'm going to date myself. When I started back in 1998, that's back when health insurance deductibles were $250.
Yeah.
And the highest deductible you could get is $1,000. So I'm sitting with a farmer in Wanata. So I'm 28 years old. This guy's in his 50s. And I'm saying, you need to get this $250 deductible, blah, blah, blah. And he's just looking at me. And when I got done, he said, boy, let me show you how math works. He said, you want me to take this $250 deductible, but it's $900 more a year than the $1,000 deductible. So please explain to me why I should pay $900 to save $750 if I get sick. It totally changed my career. Because that's the thing. Our whole lives, who's been teaching us to sell the lower deductibles? The insurance companies? Agents. The lower the deductible, the more we get paid. Insurance companies always want us to sell the highest deductible because they know in most years you're never going to meet it, and so you're pure profit to them. But agents, when we used to get paid on commissions based on the premium, we were the ones that tried to get people the $250. And guys, on my car, I've got $1,000 deductible. On my house, I got $1,000. I'd get a $5,000 deductible on my house if they would let me. Okay, why? Because I'm probably not going to use it, but man, the premium I'll save for years. And that's the thing with them. If you start talking to people in terms of math, you know what they start realizing? Seth, you're not trying to sell me anything. You're trying to help me. That's why I always kind of focus on the bronze plans on the ACA. You know, I can sit there all day long and people will say, well, I've got this Medicare supplement and it covers everything. No, it doesn't. It's costing you $2,000 a year, whether you walk in the doctor or not. How often do you go to the doctor? I only go 3 times. Well, that's some pretty expensive doctor visits. You know, that's how you snap people back into the reality of the 2 most important things you need is premium, max out of pocket. Now, a supplement's great. Supplement's great because again, I can pay $150 a month. And my worst case scenario is $240. That's really good coverage. Yeah. But what if I don't get sick? I'm just throwing this money out the window. And then if you take a Medicare Advantage plan and you throw on a hospital-wise on top of it and say, hey, if you go to the hospital, let's say you go to the hospital for 5 days. With this supplement, when you walk out, you're not going to owe anything. With this, you're going to owe $2,000, but this Medicare Advantage or this hospital indemnity is going to pay. So you're actually, it's a wash. Do you want to pay $150 and owe $240 possibly, or do you want to pay $50 and not owe anything, which is better coverage to you? I mean, so those are, I mean, we're going to talk about that in 2 weeks on how to sell the supplemental products, but I'm really going to jump into, and Tony will too, because it'll be me and Tony.
Yep.
On how to use math to sell these things.
Yeah. So, well, we
Sandra, we kind of bull our way through 2 hours.
Yes, yes. So, you know, we don't know everything, but we know enough, and we know where to find the answers if we don't know the answers. So don't hesitate to reach out to us. We're always learning from each other, which I so greatly appreciate every single one of you being on here today. And our next one is going to be on Monday. We're going to talk about dual eligibles, those that have both Medicare and Medicaid. And a lot of changes going on there as well. So yeah, so stay tuned. More changes to come. But we appreciate your time. Hope this was helpful. Yes, Joel, you had a question.
Yeah. If we want these slides, are you going to send those out, or should we email someone for them?
It's going to cost you how much, Steve? No, I'm just kidding. No, Silas is going to be sending out all of the recordings, and Steve, are you going to share your slides with Silas as well?
Or if someone wants them, just email me.
Or somebody, you can email them.
And after he takes out that segment that he'll get in trouble for.
And now I'm going to fix mine up a little bit too. So
I had a segment I'm going to get in trouble for, or Sandra did?
I don't know,
I
we
know,
probably both.
you always say,
both of
I'm
us.
gonna say something that's not gonna, that Silas probably won't like.
Oh,
No.
yeah,
I think
that was, I always
90%
get in
of the
trouble for the
messages that you
customer.
say,
Yeah, it was the customer service comment.
Yeah, that's all right. We're
I
we're
think if
usually
we-
saying something.
yeah, I think 90% of the videos that you have that statement in them, though, for one reason or another.
Yeah, I've been in this
All
business a
right,
long time.
guys.
I understand compliance, so I always like to
Yep.
put in the little
We
disclaimer.
are uber compliant, and you know what? And we do quality work, and our team was recognized for it. So I guess we know a thing or two, right? So appreciate you all being on today and sticking in there with us. And like I said, don't hesitate to reach out, Steve, Silas, myself, Gary, Derek, Tyler, any one of us. You guys need something, let us know. Thanks, Steve.
You're
Thank
welcome.
you.
Thanks
Thank you,
for running
everybody.
this, Sandra.
You're welcome. Take care. Bye.
Bye.